Today I would like to discuss briefly the role of nutraceuticals in controlling slightly elevated levels of cholesterol, specifically LDL cholesterol. The first thing I like to point out is LDL cholesterol is causal to cardiovascular diseases. And even small changes in LDL cholesterol sustained over time will reduce largely the burden of cardiovascular events at the population level. But let's face the question, who may be the person taking nutraceutical to control LDL cholesterol? Certainly are not the people at very high risk or the people who had a myocardial infarction. But in primary prevention, people with slightly elevated LDL above 100 milligrams per deciliter, which is the goal for the current guidelines, they may consider reducing their LDL level by taking nutraceuticals. By this way, they will reduce about 20% their LDL cholesterol, 15 to 20%. So if they start from 120, 125 milligrams per deciliter, they will experience a reduction that will take them to the goal that is addressed by the current guidelines. This is an important point because if you start early, at a relatively young age, let's say 35, 40 years of age, you expect a lifelong benefit that equals to the benefit you can see in randomized clinical trials where you take a drug like a statin. There are different types of nutraceuticals, and my strong suggestion to physicians is to look into the quality of the product. And the quality can be only assured by producers who have made with the drug level technology the nutraceuticals. This is important for the safety and for the efficacy and for the constancy of the effect throughout the years. The other approach with nutraceutical, which is important and it may be used, are in patients who do not wish to take a drug like a statin or feel a number of side effects related to statins, still in a moderate risk population. Nutraceutical may help to temper these effects and to allow them a reasonable reduction of LDL cholesterol, which will not happen because they cannot take a drug. So in general, from the point of view of the physicians, suggesting a nutraceutical or prescribing a nutraceutical to a patient will be in those who are at moderate risk or low risk of cardiovascular events with a slightly elevated LDL cholesterol who still do not need a drug, or those who may not take a statin because of side effects, and then you may consider tempering that with a nutraceutical.